The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
I am Dr. Paramjeet. I'm a consultant physician and cardiologist in Yashoda Super Speciality Hospital in Nehru Nagar, Delhi NCR. So I will be talking about heart disease and can it be prevented and other things. So heart attack, can it be prevented? So first we'll talk about this information is basically a verified information which has been taken from the US National Medical Library. So you can trust every single word which is written in this, right? So it's not it's not an opinion of a single doctor, okay? So first of all that. So let's talk about heart attack, whether it can be prevented and why it happens. So first we'll understand what is heart attack, all right? So basically your heart is a structure which is working like a muscular pump, okay? Its basic function is to pump blood throughout the body and then receive that blood back into its right side. So it has two parts, right? We all know that, we have studied in science and basic, in our schools. So heart attack basically happens whenever there is a blockage in the blood flowing to the heart muscles. Basic work of your heart is to pump blood to the rest of your body, but there are small blood vessels which actually supply blood to the heart. So if you can see this image which is shown, you will see small blood vessels over the heart which is coming from the above, right? Those are actually coronary arteries. Those are the blood vessels which supply blood to the heart, okay? So if one of them gets blocked, there are three main vessels, right side, left side, and the left side is divided into two. So if one of them gets blocked, then what happens? It's a muscle, it will not get blood. If some part of your heart is not getting blood because of the lack of oxygen and nutrients at that time, because heart cannot stop functioning, it's a continuously working organ. So it will face something called ischemia. Okay, ischemia means a lack of oxygen in order to do its work, to contract and relax and contract. Both this contraction and relaxation needs oxygen. So if there is any kind of even partial or near total or total blockage of blood supply to any part of your heart, then it's a heart attack. Okay, if it's a small part, it might be a minor attack. If it's a huge part, then it can be a major attack. And any kind of attack will damage that organ, right? If that big part of your heart muscles are damaged, and heart can literally stop. Okay, so it can be fatal. Why does this happen? Blockage is most oftenly because of something called as a plaque. Okay, a plaque which is basically made up of cholesterol, fat, and other substances, platelets and other molecules which are already present in the blood. Okay, basically they stick to the walls of your arteries, but they do not stick everywhere. Okay, they have a purpose. Okay, they basically stick to any damaged part of your arteries. Okay, if there is a blood vessel which has a small damage, even if your skin gets damaged, you can see that the skin, there will be clotting happening, and the clot will form like a elevated kind of a bump. Okay, you can feel the bump whenever there is a clot in your skin, right? Even outside when the blood is stopped. Same thing happens inside. If inside anything damages your blood vessels, then your cholesterol and your platelets and a lot of fat gets deposited, fibrin molecules that gets deposited, and they form a plaque. Initially this plaque is a soft plaque, okay, and then slowly over a period of time this plaque can become bigger and bigger, because the plaque will become a sticky point in which other substances can come and stick. So this plaque will become bigger, and over a period of time this plaque can rupture. So if this plaque does rupture, then an acute bleeding can happen from that particular blood vessel inside the blood. So consider the situation. There is internal rupture of the blood vessels into the blood itself. So at that point, there is an acute, the whole of the blood clots there. So there is a big clot formation which blocks and interrupts the blood flow forwards, and therefore damages the blood vessel and as well as the blood supply to the proximal part. Proximal means the forward part of that artery. So what happens if such thing happens? It will again lead to a complete blockage of the blood vessel, which will be a total 100% blockage, in which case we basically call it as an acute heart attack. Heart attack in medical language is also called myocardial infarction, and this can be fatal if it is involving a big part of your heart. So let's understand, this was the first method, first process which we saw which can cause a heart attack, and this particular process is called atherosclerosis, which is the first point here. So atherosclerotic plaque is basically the same thing which I explained, which can happen over a period of time to every. Now that does not mean that if a clot or a atherosclerotic plaque is there, it will happen only in your heart. It happens everywhere in your body. It can happen because such blood vessels are present throughout the body, right? Now it's on the basis of your lifestyle, on the basis of your genetics, on the basis of your environment. These all factors will determine which artery will have more blockages, and whether or not you will have a heart attack first, or you might have a stroke first in the brain, or you might have an ischemic attack of your intestines. So a lot of things can happen because of this particular disease, which is atherosclerotic disease, atherosclerotic plaque. Okay, so that's the first and most common method, which basically will happen in everyone. Let me tell you, there is not going to be one person in the world who does not have any atherosclerotic plaque in the body, because it's a part of natural process. Okay, so there is no way of preventing it. Now understand, but we can delay it. Okay, everybody who lives till the age of 100 will have atherosclerotic plaques throughout the body. But obviously, if you live a bad life, a bad lifestyle, this process of aging, it's a part of aging, will be enhanced, right? A person living a bad life, you will see that their skin is bad, right? They look 10 years older, they are feeling older. So obviously there are methods in which you can push this disease to a certain age so that you don't die of this problem. Okay, so that's why lifestyle matters. Because of this, you can actually control the factors which lead to premature atherosclerosis, premature heart diseases. And obviously there are some unique people in the world which might not have a lot of cholesterol deposits in their heart vessels. They might have some cholesterol deposits elsewhere in the body. Okay, and everybody will have that. First, I need you to understand that, right? So there is no way of preventing any, or every single atherosclerotic plaque. But yes, this is not the only way because of which your heart can get damaged. There are two more ways. The other one is a spasm, coronary spasm. What happens? You must have seen that your blood vessels in your arm, they are dilated when you exercise. They become big, they become swollen, right, during exercise. And during winters, during cold, you don't see any blood vessels out, even in your hand, in the dorsum of your hand you don't see, but in summers and all, you see them in the hot weather. So this basically proves that your veins, these are the veins, your veins have a capacity to vasodilate and contract. The same way your arteries also have the capacity to dilate and contract, right? And arteries are inside. Okay, so it takes a higher degree of temperature change and a higher degree of issues to make them go into spasm. And there are some factors which can actually lead to a sustained spasm. When we talk about spasm, normally if there is a spasm and it relaxes immediately, then there is no such issue. But consider even if your fist goes into spasm and you are not able to open it, even if your fist goes into spasm and you are not able to open it for 1 hour, that will be a big issue. Even for 5 minutes, that will be a big issue. You'll think, what is happening, right? Same thing can happen because with your blood vessel. Your blood vessel can go into spasm and it is not able to relax. So that can lead to that temporary cessation of blood supply, temporary stoppage of blood supply to the forward part, whatever blood vessel is going into spasm, right? So this is also a big factor. And people who smoke, people who take drugs, drug abuse people, including any kind of anabolic steroids, any kind of weight loss drugs, any kind of these kind of drugs, those are medicines, those are substances which lead to coronary spasms, including bhang. Yes, bhang is a very strong agent which can lead to coronary or even blood vessel spasm throughout your body. So coronary vessels are just one small, 1 to 3 centimeter of 3-4 centimeter thick blood vessels which can go into spasm. Because they are very small and they are end arteries, therefore people notice them first rather than having a blood vessel spasm blockage in the hand, because in the hand there are too many other blood supplies to compensate for any blockages, but in the heart there are not so much. So coronary spasm is one big life-threatening kind of a situation also which can happen. In addition to atherosclerosis, then there can be a person who has a good amount of atherosclerotic plaque which might be blocking like 50% of the arteries, and then that artery is going into spasm, right? So normally that artery is going into partial spasm and it might close only 50% of the area of other parts, but in that area where there is already a 50% blockage, that part will become completely closed. So there are many circumstances overlapping in your body over the period of years. This is not something which happens for a few days and then goes away. It is going to happen repeatedly throughout your life and depends upon how you live. Then the third aspect is actually infections like COVID, right? COVID is just, I'm taking an example of the recent thing which everybody knows. COVID was associated with a lot of heart attacks. Even the vaccine is being associated with a lot of clots being formed in your body. So yes, that is one more factor, that other diseases which can increase the chances of clots formation into your body, and those clots can go around and they can get stuck into these atherosclerotic plaques in your heart or in your brain. So that is also a serious thing. But in these kind of infection, there is also one possibility that infection will directly affect your heart. Just like, say, your tongue. Sometimes you get a severe throat infection, you are not able to speak, or your voice changes. You say, bola nahi ja raha. You say, I'm not able to speak. So this kind of an infection, if it affects your heart or muscles of your heart, then that part of the muscles will not able to pump. So we call it myocarditis, right? That is the myocarditis, mean muscles of your heart is getting infected, and that can cause temporary or permanent damage of the heart if that is not controlled in time. Okay, so there are so many ways which can lead to damage of your heart, or they can combine and lead to heart attack. So then we'll talk about what kind of blockages can happen, right? There can be a complete or a partial blockage, and according to these kind of blockages, we see changes in ECG, right? If you have a complete blockage, then what we call it as a myocardial infarction, and we see a elevation in your ECG. I'm not showing ECG here because that's not relevant to you, but I'm just saying that we can predict just by looking into the ECG that yes, you have a complete blockage and this needs that's an urgent situation. Same way, a partial blockages might not show any sign in ECG, meaning even if your ECG is normal, you might have a heart pain. That's why we need additional tests in addition to ECG. So diagnosis and treatment will depend upon what kind of blockages is there and what kind of symptoms you have, right? So what symptoms can you have? If you have a partial or complete blockage of any blood vessel, and that blood vessel is basically controlling a big part of your heart, you can feel pressure or tightness or pain or any kind of squeezing, aching sensation in your chest, or that can radiate anywhere near this area. That can be, feeling, it's not necessary to feel pain or symptoms only on the left side because heart is on the left side. No, you can feel it in the center. It can be a little bit below the rib cage. It can be in the neck. That depends upon which part of heart is affected. If the upper part of the heart is affected, it might be radiating to the neck. If the left side of the heart is affected, it will be radiating to the left arm. If the lower part of the heart is affected, you might feel pain in the abdomen, upper abdomen. So any pain near this kind of an area which is increased during exertion, right? Obviously, when you exert, when you walk, when you run, your heart rate increases. And if there is a blockage and that heart has to work faster, the symptoms should increase, right? So that is an exertional kind of a pain which we call angina. So pain, so any kind of thing around this area may be a heart attack. It might be other things, but there can be a heart attack. So what we need to see other symptoms. If it is a heart attack, especially if it is a lower heart attack, you might feel nausea, indigestion, you can hear heart pain or heart burns or abdominal pains also. You can feel that. And those symptoms can happen because of an abdominal infection also, right? Because of other diseases also. That's why a trained physician needs to judge according to your symptom, according to sign, according to ECG, whether you have a heart attack or not. Then if your heart is being attacked and is not able to pump, then obviously you will feel fatigued, because heart is not pumping blood that efficiently throughout the body during that time, and obviously the blood will back up into the heart, and all the blood which is getting received from the lungs into the heart, that lung will again have back pressure, right? Just like a traffic jam, there will be a traffic forward jam, the backing up of the blood will be there, so there will be increased pressure in your lungs, and you will feel easy fatigability, shortness of breath, or sweating. You will have a lot of sweating, right? That can happen. Sweating happens because you're afraid what is happening. A sympathetic response happens. All your small blood vessels, they get contract during this time, because your heart is not able to pump forward, so your body will stop all the unnecessary blood supply to your hands and try to adjust the blood supply to the vital organs, because a less amount of blood is coming out of the heart, but all the other parts of your liver, your kidneys, your intestines, your brain, they need blood. So your body will adjust, but still if it is not able to adjust, then you will feel dizzy. If your blood pressure starts dropping because your heart is not able to pump, then you will feel dizzy, you will feel lightheaded, you might faint. So this is how the symptoms of heart attack progresses. Sometimes it can stop during any moment. You might feel a little pressure and then it goes up. Then again you say it's okay, nothing happened. Then again you are having the little pressure and go away. Whenever you are exercising, you're having a little pressure, it goes away. So that might be an early indication that you are having an angina on exertion. At this might be the time the indication of your body that something is wrong with the heart. It's not 100% blockage, it might be a partial 70%, 80% blockages, which is leading to some kind of symptoms. If you don't attend to that, if you don't do tests, then it can in near future become a serious heart attack. Variations can be there in these symptoms. Like I said, not everybody will have all the symptoms in the same exact manner. Some people will have a little pain and then it goes away. Some people will have pain for a few hours and then it goes away because of the spasm factor is there. Like I said, there might be a blockage 70% plus there was a spasm for 10 minutes. So patient had pain for 10 minutes and then it went away. But still there is a 70% blockage. So still there is a potential coronary artery disease, right? So there can be 100 variations of this kind of a scenario in you or other people. So we have to find out whether you have a heart disease or not. So even if you have mild pain or a severe pain, some people can have less symptoms, some people can have more symptoms. And if you have diabetes or you have neuropathy, because the feeling of pain is only there if there are nerves to actually sense that pain, right? You must have heard about diabetic neuropathy, where diabetic patients, they don't feel pain in their legs and they end up with a big diabetic ulcer. Same thing can happen in their heart, because of which they don't really feel pain even if your heart is getting damaged because of no blood supply. So some people can have zero pain, that we call as silent heart attack. Okay, so first in these kind of a patient, they don't really feel anything. All they will feel is that if they are exercising, they feel a little bit of chest heaviness, and these patients can even present with a sudden heart attack, cardiac arrest. They basically have no symptoms, just they come into the AR and they don't really, their heart is not working or they are unconscious. So these kind of severe onset of symptoms can also happen. However, obviously many patients, majority of patients will have some indications of disease in their body, which you should look for. Next slide. Let's understand what are the early signs of heart attack and what you should look for, right? Some heart attacks will have warning signs, okay, which might be there for few hours or days. Like I said, angina on exertion. When you're walking, when you're running, there can be recurrent chest pain which is getting triggered by exertion, right? And that might be angina is basically because of the temporary decrease in blood flow to the heart because of spasm or because of running. Because when you're running, the heart has to work more, and because of that increased workload, it requires more blood, and because of the blockages which is there in the heart, that increased amount of requirement of oxygen is not being fulfilled because of the reduced blood supply of the heart. So that's also an indication that okay, there is a blockage, and it's a significant blockage. Okay, that is there. Next slide. Let's understand what happens if your heart gets damaged because of reduced blood supply or myocarditis or any kind of damage to the heart. Right? Heart is a pump. Obviously, number one, your pump can fail, or there can be, because pump has a rhythm. Right? Heart has a rhythm where the upper part contracts, the lower part fills, the lower part contracts, and it goes out of the body. Right? Out of the heart into the body, basically. So if this pump does not contract in synchrony, if it contracts, both contract together, or one doesn't contract and the other contracts only, or it doesn't really contract, it just flickers, all these things are called arrhythmia, rhythm problems. They are basically because of problems of electrical circuits in the heart or damage to the heart muscles. These all things can happen, rhythm problem can happen, and sometimes because of these rhythm problems, heart can stop, even if it was a small minor attack. Especially if it is actually damaging the area which actually controls the rhythm, the pacemaker in your heart, the SA node, AV node, which you might have heard. There are SA node, AV node. If they are damaged, then the heart can literally have arrhythmias and it can stop. So that's a risk. That does not mean that will happen to everybody, but in many people it does happen. So rhythm problems can happen. Second, if you don't really open the heart attack, within a specified time, within a few hours, then heart can get damaged, and the tissue damage can become permanent, right? And obviously, like I said, heart will not able to pump blood forward, and the back pressure will create a traffic jam of blood, leading to heart failure. The jam blood will accumulate in the lungs, increasing the pressure. So lung pressure will make what does it do? It basically increases fluid accumulation in the lungs, which we call pulmonary edema, that leads to shortness of breath. Initially, you will have shortness of breath while walking only. Then you will have shortness of breath only while standing also. Then you will have shortness of breath while lying down. Then you will have shortness of breath while sitting also. So it will be a progressive dyspnea or shortness of breath on exertion. This is how that progresses. Next slide. And if all this happens very fast, if a huge clot is there in the base or root of the blood vessels involving more than 50-60% of your heart, then your heart can actually suddenly stop without any warning. So that can also happen because of and it can also happen because of the rhythm problem, electrical abnormality. So heart attack, rhythm problem, major heart attack can all lead to cardiac arrest. Cardiac arrest does not mean heart attack. Cardiac arrest means heart. Cardiac means heart. Arrest means stop. Heart has stopped. Heart should not stop. If that stops, you are gone. So cardiac arrest is much more serious than a heart attack. And cardiac arrest can happen because of other reasons also, but heart attack can lead to cardiac arrest. So next slide. So what can you do, right? What can you do if such things happen? If you feel any kind of heart pain or you see somebody feeling that, immediately you should go or get them to a hospital. You should ask for help. Do not try to drive yourself to a hospital, because if you are really having a heart attack, you might faint while driving, right? You might fail while driving. You should call somebody or call a local hospital emergency for an ambulance, but you should get to a hospital immediately. Next slide. Immediately. What will they do in emergency? During the emergency, they will give you a few medications. Usually, there are some things which can be done immediately, and there are some medicine which can help. You might have heard about medicines which people keep below their tongue, right? Sorbitrate or something. These are nitroglycerin or nitrates. What they do is basically they temporarily open the blood vessels. They might open the blood vessel. Now, it's not compulsory that they will open your cardiac coronary vessels also, but they may open it, right? But the problem is they don't just open that blood vessel, they will open all the blood vessels in your body, and they will basically drop your blood pressure. So you should not take them if you're already having a low blood pressure. If you know, some people come into the emergency with a very low blood pressure and they say, I took 3 tablets, I took 4 tablets, I took 2 tablets of this because doctor told me. Doctor always says if you have any problem, you take 1 tablet. But then they say, okay, this can open blood vessel, let me open them all. That doesn't work like that. If you take overdose, it can lead to a serious side effects, right? Because if blood pressure drops too much, remember, the blood which comes out of the heart needs to come back to the heart also. If it does not come back, taking the circle, if the blood vessels opens too much, it stays into the periphery, there will be no blood coming into the heart and heart can stop. So it's not so simple. So you should never do self-medication if especially in a heart attack kind of a situation. You should talk to a doctor. The doctor should ask, what's your blood pressure, what's your pulse rate, come to the hospital. Okay, if you're not able to come, take this medicine. So the doctor will tell you what medicine to take and how much to take. You should never take it by yourself. And nitrates are one medicine which may be used, but does not mean they are 100% safe. Second, aspirin, ecospirin, clopidogrel, dispirin, all these are blood thinners, which basically are not really blood thinners. They are antiplatelets. Like I said, when the plaque ruptures, there is bleeding inside the blood vessel, and active bleeding has to be stopped. So there is a small, there in the blood vessel, it's very small. So even if a small clot is there, it can partially, stop or block the blood vessel. And many times that blockade, that clot becomes bigger and bigger and bigger, does not really stop. And that leads to a big thrombus, a big clot which is blocking the entire diameter of the blood vessel. So antiplatelets basically prevent that clot to increase. They don't really dissolve the clots. Okay, they don't really dissolve the clots, and they don't really start working immediately. Okay, antiplatelet like dispirin, aspirin, they will, when we give it to you from the mouth, remember they have to go inside the stomach, then get dissolved in the stomach, go into the small intestine. After 1 or 2 hours, they get absorbed into the liver, into the blood, into the liver, then they go into the blood, then they reach the heart, and it takes so much time to start their action. And actually the result of that that tablet will take 24 to 48 hours. So really those medicines are for the future, because basically during a heart attack, what we say, it's a procoagulant state. That means clotting can happen repeatedly. Even if you open one blood vessel through medicine or through any way, the clot can happen in other blood vessels also, or there may be a lot of clots. So basically we have to give antiplatelets so that other clots do not form. So it's a part of treatment. It does not mean I took aspirin or I took dispirin, now I am not going to die. No. Okay, so if aspirin is recommended, you take it, but that can increase the risk of bleeding also. If somebody has, already has risk of, bleeding through piles or bleeding in a little bit of bleeding can happen. But that's where your doctor will judge whether that bleeding is very severe or this is an important aspect. Okay, next slide. So there are some medicines which your doctor can give immediately, and there are some injections also. We're not talking about that here, but let's talk about what you can do. Right, so if you see somebody, you should definitely check whether they are breathing or not, whether they have any pulse, whether they are okay, but never let them walk, never let them do any work by themselves, because if they walk also, it will increase the pressure on the heart. Right, so that person should never walk. You should take them in a wheelchair or a stretcher, in an ambulance or a car, immediately to the emergency center. Next slide. And if somebody is unconscious and says, I have a heart attack, I have a heart pain, then what you can do a CPR, right? All you can, even if you don't know the actual method of CPR, you can just push hard and fast in the sternum, central or part of the chest, just 100 to 120 times in a minute. You don't really have to know the exact method of doing CPR. Even if you just do this, just start pushing and keep pushing till the person actually regains consciousness or ambulance arrives, then also you will save that person. So CPR is something which you should know about. And second, you can also see if there is something stuck in his throat or not, right? Next slide. So let's understand how you can prevent heart attack, right? Why people do have heart attack. Like I said, it will happen to everybody, but just like death will happen to everybody, but that does not mean you should die at the age of 30, right? So there are people who live a very bad life and they die young, right? So what can you do to actually live a normal life where your heart attack actually happens after 70 or 80 years of age? So you can do that by understanding the risk factors, right? Obviously age is a big risk factor, right? Anybody who is over 45 or older, especially women older than 55, they have a very high chance, and men older than 45, they have a very high chance in the sense risk of having a heart attack. Now, then the biggest factor after age is stress. Nowadays, a stressful life basically increases those cracks inside the blood vessels, because it increases inflammation into your body. So a lot of inflammation into your body increases your risk of heart attacks. And any kind of stress, work stress, family stress, money stress, life insomnia, not sleeping is a big issue, right? Third risk is obesity. Obesity is linked with all the bad things which you can think about: high cholesterol, high triglyceride, blood pressure, diabetes, high inflammation into the body, not able to sleep, not able to exercise, cardiovascular issues, systems are not really compliant. So it's bad. Obesity is really bad. Just losing 10% of your body weight can lower your risk very significantly. So you should be, your weight should be in a normal range. Then history of preeclampsia. What is this? Preeclampsia is high blood pressure during pregnancy. So any high blood pressure increases the risk of cracks into the blood vessels, and these cracks will be filled with cholesterols. Basically, cholesterol is important because if you don't fill the crack, right, your blood vessel can burst, and if it bursts, then you don't even get a time to go to the hospital. Your heart will stop, right? So it's important to mend the cracks also. So it does not mean that cholesterol is at fault. Okay, it means that your lifestyle needs to be accurate, right? So your blood pressure, your obesity, your stress needs to be controlled. Cholesterol, if it is very, very high, then it's a problem. You should keep it under control. So high blood pressure during pregnancy is called preeclampsia. Next slide. And any blood pressure will increase the chances of more cracks and more inflammation into the blood vessels. What about diabetes? Diabetes is a huge predictor. You can say any diabetic patient will have heart disease if the diabetes is more than 10 or 20, 10 years old. Will have heart disease, will have some atherosclerosis all over the body, because diabetes is a pro-inflammatory disease. More sugar, if it stays in your blood for a long period of time, it is inflammatory. Inflammatory means it irritates the blood vessels. It leads to more spasms. It leads to more clottings inside the blood. So it's bad. So diabetes and insulin resistance is bad, and it increases your heart attack risk. Same goes with metabolic syndrome. Metabolic syndrome is obesity, high blood pressure, diabetes, motapa, sedentary lifestyle, all those things. So metabolic syndrome will lead to increased risk. And tobacco, smoking or chewing or even secondhand smoke will lead to stiffness, hardening of your blood vessels. So if your blood vessels are hardened and next time they go into spasm, they might not relax. They might not be able to relax because of the smoke, because of the spasm. So it's not really the smoke going inside the blood vessels, it's the particles from the smoke. And I'm not just talking about smoking. Even if you work in a smoky environment, in like chulas and all, that smoke can also damage your blood vessels. So every smoke is bad. Tobacco smoke is 100 times bad than that. Next slide. So these are the risk factors. Then a big risk factor is lack of physical exercise. Lack of physical exercise, because physical exercise is the only single thing which can open additional blood vessels if there is a blockage in your heart, right? That we call as collaterals, right? So consider that there were 3 blood vessels in your heart and one gets blocked. So what happens if you exercise regularly? These two, the rest of the blood vessels can actually, if there is a close by blood vessel, if there is a branch, these two will dilate, slowly increase their size to compensate for the blockage which is happening in the middle one. So this only happens if you are regularly exercising. If you are if you don't really exercise, even with the blockage, your heart is getting little blood, and that is sufficient for your heart because you are not exercising. But if you exercise, because that blockage will not happen in one day, it will happen over years. And during that years, if you are exercising, slowly, your heart opens collateral blood vessels. And even if that blood vessel gets blocked 100%, you will not get a heart attack, because during that time, your blood vessels are already covering that particular part of the muscle, which will get collateral blood from the other part. So that's why many people who smoke, who are obese, and many army people who are smoking or obese, they don't really get a heart attack because they have a habit of exercising. They are smoking and they are having a habit of exercising. So there are so many factors working together, right, into your body, and this is one of the big factor: lack of exercise. Lack of exercise, smoking, obesity, illicit drug use, illegal drug use, including amphetamines or bhang and other things, smack. Autoimmune diseases, autoimmune conditions like rheumatoid arthritis can also increase the risk of clots inside the body, increase the inflammation into the blood vessels, leading to, again, any inflammatory disease will lead to inflammation in the blood vessel, leading to plaques, leading to blockages. And family history is also a big factor. Genetics is also a big factor, meaning, next slide, if your father, mother or close relative had a heart attack at the age of 50, you have a chance of having a heart attack 5 or 10 years younger if you have a bad lifestyle, if you don't do testing. So you can have a heart attack 5 or 10 years younger. So such a serious problem this is. Then let's talk about high blood pressure. High BP, high cholesterol, high body fat, these are very important, and over a period of time they damage the arteries, leading to clottings, heart attack. High blood pressure increases the load on the heart also. And high blood cholesterol or triglycerides will increase the amount of cholesterol which gets deposited whenever there is an inflammatory crack inside the blood vessels. So increasing the amount of blockages there are, right? So you have to reduce all these things. You have to reduce the bad cholesterol in your body and increase the good cholesterol. Okay, next slide. Now, remember, to prevent this, it is much better than curing it afterwards, right? Once, if after like 10 years of atherosclerosis has happened, there is no way of getting back to normal. You can just keep taking medicines, have a good lifestyle, and then pray that you don't get a heart attack in future. And there will always be a chance of a repeated heart attack, even if you do any treatment, even if you get a stent or angioplasty or bypass surgery or any kind of treatment, you will still have a risk of having another heart attack if you don't really have a good lifestyle from now, right? From the age of 20. If you don't really have a good lifestyle from the age of 30, you cannot expect to prevent this later on after reaching to the age of 50 or 45. It's really not possible. But yes, medicines are there which can help. So you should take medicines if your doctor says, and lifestyle factors are very important. Whatever I have said, including smoking, if you smoke, you have to stop. You have to eat a healthy diet, manage your stress, control your sugars, blood pressures, and most importantly, check them. If you don't really check them, many people don't check them. If you don't check them, you will not know what all risk factors you have. And if you wait for the symptoms will not come immediately. Symptoms will come only when your body cannot handle it, right? Even if the temperature is increasing slowly, your body will not tell about it to you. If your eyes are closed and if you don't really feel it, then you'll not burn your hand. And when you start to burn, at that time your skin is getting damaged. So what I mean is, prevention is better than cure, and it's in your hands by living a healthy lifestyle. That's the only way to prevent heart attacks, or push them away to a certain age where you live your life completely, and then even if you die of other reasons, you are not having any issues. So next slide. Thank you so much. This is all. I think I've covered heart attack in immense details, and if you have any questions, please feel free to ask.
Rolling up the payroll, you really buy my good a lot. Big butt hump, shot for shot. If you wanna scrap, pull up, baby, egg roll, rolling up the payroll.